Welcome everybody, welcome to Singularity Watch, a show where we investigate the future of emerging technologies and how they will affect our lives when they become mainstream, and if they become mainstream, but they probably will. So, I'm Ollie, and as always my co-host and inventor of this show is Kavya Perlman, founder of the XR Safety Initiative, XRSI, and award-winning cybersecurity professional. Hi Kavya, how are you doing?
Doing good, Ollie. How are you doing?
I'm not too bad. Our guest today is Rachel Michelson, who is the medical XR advisor for XRSI, with a background in software development and the evaluation of medical devices from the point of view of cybersecurity risk. Rachel, can you tell us a little bit more about your background? Because I sort of summed it up as best I could, but there's probably much more to say about that.
Certainly. Great to be here with everybody and in this exciting environment that's new to me, as I would think it's going to be new to many people, but they will be adopting it soon. So I have about 25 years experience in the software industry altogether. I spent the first 20 years in the public safety devices manufacturing, things that police uses, things that firemen use, our brave first responders have to have safe and secure tools for their communications. And then after those years, I switched to cybersecurity and started evaluating medical devices for cybersecurity. And this brought me into the world of virtual reality about a year ago, actually a little less than a year ago. I met Kavya and I was very happy to join this worthy cause of making XR environments safe.
How much of your personal experience helped you to build your career?
Well, personal experience, blends with your professional experience. You can't divide the two. I am an engineer first and foremost, but I'm also a mother, and I worry about what the technology is going to do to the world where my children live. I certainly see how they feel about the technology. Let's say I'm calling my child to dinner and they're busy playing a game and they are far away and they are with other people and they're part of a team, and the team can't really function without them. So me calling them to dinner and saying, drop what you're doing and come to dinner right now doesn't work for them. So I have to get used to that paradigm and I have to work with it because I'm helping build it.
And do you think, when one wonders about the impact of technology now, one always talks about technology as if it's like about to come now, but this has probably happened, even centuries ago. And do you think it's always been the same? Like people have always sort of seen the new technology as something that would change rules and be dangerous? Or do you think that we've reached a point which is slightly different, where technology is going to take us much further from what the human dimension is as we know it?
I don't think this is any different, and I have that opinion about everything that we're experiencing right now, even the pandemic. There have been pandemics in the past. There have been wars, there have been hunger, and none of this is new. The details change, but the principle stays. That's my opinion. That's my opinion. And yes, even with technology, if you say singularity is coming for us, we're going to be controlled by all these creatures, that's not a new phenomenon either, because for a while we've been saying simpler jobs are going to be eliminated by technology. If you can have a robot dispensing food at a McDonald's, that deprives somebody of a job, And so what do we do about that? We contribute to that. So this is not new. This is not new in my opinion.
So basically we must be feeling a little bit like how people were feeling before the Industrial Revolution, or at the beginning, something like that. And, it's the same kind of thing that goes on in history. So, Rachel, what's your most compelling memory of immersive tech?
Well, I can start with the first time I put a headset on. So I don't know if the audience knows, but these devices are not too friendly for somebody who has limited use of their hands or another limitation, myself included, because I have limited use of my left hand. So for the first time, I wanted to put on a headset. First of all, it was not too easy to put it on my head with a single hand. And then I encountered various menus that had me type in a lot of data. And I ended up asking my daughter to help me with that. So that presented a number of problems. When you switch the headset from one head to another head, the device wants to go to sleep mode. It's trying to save battery. So then there's a 20-second delay of when she's trying to help me out, and there's 20 seconds every time. And then furthermore, in the pandemic that we're having right now, there might be a hygiene question. What if two coworkers need to help each other out and taking turns switching the headset between their heads? How do we disinfect? How do we make this acceptable in the workplace, work environment? So those questions came to me when I was using the headset for the first time.
And Rachel, I feel it's so remarkable that you use that experience to fuel your passion to inform us. And so I just want to thank you for, taking on the lead on these issues and helping us out at XRSI.
My pleasure. This will benefit a lot of people. People that are not as technology savvy as present company. And people that are disabled in some way. And this is virtual reality. The key word here is reality. We need to make it real for them. We need to make it acceptable for their daily lives, for this to be popular, for this to be useful.
So that was kind of like a guiding thing, first-hand experience that guided you into a series of ideas, I guess, right? Of how things could be developed on more than one level, I suppose.
It certainly did, especially with my background in, let's say, police radios for public safety. Those devices are very sturdy. Those devices, when they fall to the floor, we call it a drop test. They do not break. And the battery lasts a whole shift. If a professional firefighter, let's say, or a nurse has an 8-hour shift, the battery has no trouble lasting that amount of time, and then does not go to sleep. The device does not go to sleep because seconds matter. So that's what we should be striving for in this technology as well.
Absolutely. With regards to healthcare, XR is gradually making its way into healthcare, and I'm wondering, what do you think is its potential there? What do you expect to see? What are the areas also for people watching or listening? Because people might not think about, XR in healthcare. They might just kind of think about it for gaming or for meeting people. So can you give us kind of an overview of what's going on in that area?
Well, my personal dream is that the doctor and the patient sitting in the room will welcome this device into their environment, because the device will not preclude them from looking at each other, from having a conversation, and all this heavy computing that right now happens on a screen in front of you will happen in the background, while the doctor and the patient can continue their relationship the way it's always been. Because current medical devices, although useful and nobody doubts their necessity in the field, actually precludes the doctor and the patient from having a good relationship. For instance, when I've heard surgeons complain that the nurses used to take care of them during the surgery, used to help them and give them instruments and things like that. And now instead of that, they have to be typing at computer screens. And that doesn't make the surgeon happy. And me as a patient, if my doctor is looking at the screen, which they have to, instead of looking at me, I do not feel good. I do not feel I'm getting adequate attention. And the doctor is frustrated as well. So with this technology, we need to strive for making it intuitive, for making it such that doctors and patients welcome this device rather than saying, oh, yet another thing for me to do during my appointment with my patient. And then, so this is a second chance if you think about it. We do have medical devices in the industry, but their user interfaces are not the best.
So that would be like to do with the bedside manner of doctors with patients when they're being visited, right? And I know that they've been doing some kind of training as well for operations, I think, is that? How does that work? I mean, do you know anything about that?
Yes, I do. As if imagine, let's say, an oral surgeon or a dentist is working in somebody's mouth, and the students are all crowded around them, straining their necks, trying to see what the doctor can see. Well, guess what? They did that 100 years ago that way, and they're doing it that way now. Imagine if everybody instead had a headset and were able to see exactly what the doctor is seeing from all sorts of angles.
It's probably nicer for the patient too.
Nicer for the patient. What's really nice for the patient is that pre-surgery, they could try different methods of accessing, what they need to access in somebody's tooth. They would try this way. That doesn't quite work. They would try again. And then they would go to the surgery much better prepared and torture the patient a little bit less.
Yeah. So that sounds amazing.
And even calming patient down, I would say, don't you think, Rachel? We have so many of these people that are building like mental health applications, and especially now in pandemic time, just like all this data that indicates to us the state of mind, cognition and all. It seems like we're right on the money here, because it's such a necessity to innovate to be able to deal with that second pandemic of mental health, don't you think?
Certainly. And we do have a lot of entrepreneurs and a lot of Silicon Valley types looking into mental health applications at the moment because of the pandemic. What they sometimes lack is the funding to do proper medical research on the effectiveness of their application. Let's say the medical industry is certainly operating upon doing proper case studies and proper medical trials, phase 1 and phase 2 and phase 3. And that's an expensive and time-consuming procedure, and then you got to have an FDA approval. So the software development cycle in the medical industry is a lot longer than it is, let's say, in the gaming industry. We're used to moving fast in the gaming industry or another industry that's not regulated so much, and it's not so safety centric as medical is. So they're not used to that paradigm, and it takes funding and takes a different mindset. And that's where the community needs to be educated, that it's not as easy to come up with an application that does mental health. And even if they do, other questions arise, like let's say something called habituation. What if the subsequent exposures are less effective than the first ones? So that needs to be studied, and before something can be declared a medical treatment, certainly all these questions have to be answered.
Yeah, and because there are a lot of studies on pain management, for example, or I think it's basically with the principle of distraction from the real world, so to speak. But I think if I understand what you're saying maybe at the fifth, if that's just going to be during an operation or something, that's one thing. But if it's going to be something protracted in time, then people can it might not lose its effectiveness or something like that.
That's right, and that needs to be studied. That needs to be investigated, to see how effective it's going to be in the long run.
What are the risks you see from your experience, especially from the cybersecurity point of view, as relates also to healthcare, of course?
Certainly. So cybersecurity, from what I've observed right now, the methods that a hacker would use to break into a device are the same methods that have been always used by hackers. Like, let's say if they discover a file that is not protected well, that doesn't have access control, that doesn't have integrity checks, that through that file, a hacker can get in. Or if there's a network stream going in without those same measures, that somebody can modify that stream. Or if there's a camera on your device that doesn't give feedback, that you can't tell if the camera is on or off, those mechanisms are the same, but the consequences are very different. The consequences are a person might be moving in the wrong direction and falling down a set of stairs. A person might be, because if their eyes deceive them, if that file or that network stream or that camera represent the immersive part of it. And if the person is not seeing what they think they're seeing, obviously they can be made into a human joystick. You can get them to move where they shouldn't be moving. You can also make them, you can confuse their brain. You can show them images that don't make sense to the brain and cause the person to become dizzy, disoriented, and fall down and hurt themselves. So same techniques, different consequences when it comes to cybersecurity.
Some new forms of cyber attacks you're indicating, Rachel. Then I have to also add and ask about privacy. Recently XRSI released this privacy framework. Is there something different about, the kind of data we are consuming? And certainly I definitely know the answer, but I definitely want to hear your perspective on medical XR side.
Certainly. So privacy. If in the traditional forms of privacy, I have my username, I have my password, I think my stuff is private. So that paradigm is changing with the addition of VR, because so many cameras and so many sensors are looking at me when I'm in VR this very second, that really a password does not protect me. My identity can be established 100% from the way it's looking at my retina and the way it's looking at my iris and things that I do in terms of my behavior, the way I hold my head, the way I hold the two controllers with a single hand. Those are types of, you would call them biometrically inferred data, not necessarily something that a sensor would detect right away, but something that could be inferred from my background. That anonymity or impersonation of one person by another by just stealing a password, that's what used to happen in the past, that's no longer possible. My identity is right there. So if somebody is in the data, so if somebody is looking to establish the fact that it's truly me, they can do that. And that changes the definition of privacy, and that changes what we should be looking for. The data is there. We have to accept that fact. When I am protected by an account, if I want to create a fake account in the regular environment, I'm going to say that's not my data. I'm disassociating from that data. No longer is this possible. So the data is there. All we have to do is figure out how to protect that data and see who has access to it and how long they have access to it. Well, easier said than done. I'm not saying this is easy to do, but the paradigm is shifting. As always in life, when you solve one problem, you gain another problem. So now we have all this data. We have to figure out what to do with it and how to make it safe and who does it belong to and what happens to a minor child when the data is first controlled by their parents, but then the child reaches the age of 18, and who gets control of that data and how does that happen? Many questions.
Okay. Yeah, a lot. One thing I was kind of thinking about when you were talking also about, the risks for somebody who could be made to see something which isn't there or, fall down and stuff like that. And also related to this discussion on privacy, we're kind of used to seeing in other industries which aren't nearly as well protected, probably because it's usually we're talking about gaming industry again or other industries like this. We're used to kind of the idea that, we have on one side the hackers, on the other side the people who are putting up defenses against the hackers. And we're used to seeing, hackers in the end manage to find a way and then something gets done to stop them from getting in. And then, the guys find another way to get in and stuff. And I think a lot of people would be worried, your average person would be worried that there's no real way of keeping them out for good. I mean, I know I would be worried, is it possible? How do you face that? You have like closed systems which aren't accessible unless you're kind of in that system, or does it just mean one has to invest more money, or are there sort of techniques that are costly but exist now to do that, to implement that? What are the plans to go towards that kind of data protection?
Well, cybersecurity is as strong as the weakest link. So for instance, I could have the best mathematically proven algorithms to protect and encrypt my data, but if I post my password on the wall, that becomes useless. So,
Okay, yeah.
so that's actually, to cybersecurity, there's a huge human factor like this. Yes, mathematically you can do things, but people are people, and people will take shortcuts, and people are, somebody can bribe a person, somebody can blackmail a person into disclosing a secret. There are many ways to influence a human. So this being a chain, how I visualize this is a chain, and then there's a weakest link in there. So what all you can do is go eliminate the weakest link, make them stronger. The chain will never be perfect, but you can make improvements by addressing the weakest links, which frequently have to do not with technology, but with the humans.
Is there any way that something like a password could be protected by not actually having a password, but by the system recognizing you so that you don't even need a password and you don't even know what password to give, so you have no way of revealing it, for example?
Certainly in XR, that certainly is a possibility, because yes, we have cameras looking at our eyes and analyzing our behaviors, and the algorithms do exist to check somebody's identity, so a password should not be necessary. This should happen in the background as the doctor and the patient are having a normal conversation. You would have a continuous authentication. You would see the camera, and the algorithms would figure out who these two people are without any passwords. But to some people,
nice.
that's from a technology point of view, I welcome that. From a private citizen point of view, I'm worried. I'm worried that data falls in the wrong hands. In the medical field, for instance, if you talk about adherence to taking your medications, let's say a doctor prescribes you to take one pill every night. The doctor has no idea, there's no feedback from the pill that says, oh, I've been eaten every night. That does not happen. With this technology, yes, there's 100% proof. There's 100% proof. Did you go into XR and do your session, and which exercises did you do? That there's 100% evidence of that. That from a point of view of medical industry, I applaud that. I say that's wonderful. A doctor has feedback whether the patient is adhering to what they were asked to do. From a privacy point of view, I'm worried. This is a new paradigm, and we need to deal with it as a society.
There's a lot of nice meaty details you're giving us on this, because it's something, it's nice to get into the sort of details of the stuff. So how do we take what we learn from the medical sector in the rest of the industry? Is there a communication point? Is there something we can sort of connect between these two sectors, things we can learn from one towards the other and vice versa? For example, also the other way it could be possible, I don't know.
Well, the organization like XRSI certainly can facilitate the discussions between the two industries. There's probably no other mechanism that I know of right now to do that. It's up to the community to do that, because the two sectors are fairly disjoint and they play by two different sets of rules. So I'm very happy to be here in this organization and be able to help bridge the gap. The gap is, I see two parts to the gap. One is the companies trying to enter the medical industry and trying to produce medical devices. They have to learn about the rules of the industry. They have to learn about the FDA requirements. They have to learn about doing clinical trials. They have to learn about fortifying their devices to be safe and secure and private. So they have to bring themselves up to the standard of an industry that is risk management oriented and safety oriented. That's one problem. And another issue is for the medical industry to adopt to the new challenges of XR and deal with the new types of data that we produce, the biometrics, the biometrically inferred data, and all this other types of data that didn't exist before. Nobody was collecting that data, but now it's being collected, and we need to know what to do with it, how to properly handle it so it doesn't fall in the wrong hands.
Would you like to tell us a little bit more about your work with the Medical XR Council at our XRSI?
Certainly. So within XRSI, there are several distinct programs, and the Medical XR Advisory Council is one of them. We have about 10 members right now. Some of them are clinicians, some of them are regulatory experts, there are some entrepreneurs, and we're looking for more members. We're looking for representation from the payment industry, that would be the insurance companies. We're looking for more diverse list of people that represent various facets of the medical community and at the same time understand technology. And our members are involved in a number of research projects, one of them being the hygiene project, figuring out proper protocols for disinfecting the headsets between users and also within a single session between two users sitting next to each other, helping each other out. So we do have our community. We're going to tackle other issues pretty soon having to do with privacy, having to do with cybersecurity, having to do with a low-tech situation like hygiene, a variety of issues, because in the medical industry, any little discomfort that, let's say, a doctor experience or a patient's experience may just break the deal and make the technology unacceptable. If a person becomes dizzy during the use of an XR device, that's going to break it. If the battery dies during your session, that's not going to be acceptable either. So it has to be very comfortable. It has to be comfortable from the point of view of...
I was wondering about that. You've got a lot of people, producing software for various aspects of healthcare, and as long as you're teaching, like training somebody, that could be one thing, and you might say, okay, this, some headset is might produce slight discomfort, but it might be a student learning it, so it might not be something you're quite as worried about. When you're going to give it to a patient, then how does that work? Do you have a separate, the software certainly is going to have to be validated by, national or international bodies so that you can put it on the market. But what about the headset? Because if you're using a headset that you don't produce, then how does that work for people who are developing this kind of stuff?
This problem is not new. Every medical device, let's say I'm making an X-ray machine, so I'm an expert in X-rays, but I may not be an expert in operating systems or networking software, so I purchase those things. I do have a supply chain. I do have a list of vendors and the manufacturers that I currently work with. And it's up to me, the manufacturer of a medical device, to pick responsible vendors that care about cybersecurity, vendors that test their products very well. A manufacturer of a medical device cannot just go on the web and download some version of Linux that is free and cheap and outdated. They have to go to a reputable vendor. So there are vendors out there that specialize in producing high-grade, high-quality components that are suitable for medical devices, and the same way they may be suitable for the industrial controls for a nuclear power plant or something like that. There are vendors that specialize in that. And so the same will have to happen in this industry, that the headsets have to be fortified and they have to be tested to the rigorous standards that are required in the medical industry.
Right. And is this happening for certain headsets now? Are there headsets that are more indicated for this use? Or would that automatically exclude 90% of the headsets we know, ranging from the Vive to the Oculus Quest or stuff like that?
I'm personally not aware. I'm personally not aware of a hardware that's been certified. But let's say there are standards out there. So I'm not aware of a headset that claims it has been certified to adhere to a certain quality standards. No, I'm not familiar with that.
So that's really interesting. It's something you don't hear people talk about very often. So it's something. So it's singularity time. So as always, at the end of each episode, we ask our guests what the word singularity means to them. So the question is obviously, what does it mean to you? And do you think we'll reach one in the foreseeable future? Whatever it means for you, obviously.
If I could predict the future, I'd be very rich right now, but so I'm not going to be able to predict that with any degree of certainty. But it is the same problem that the community has been dealing with. Things develop, and we are afraid they're going to get out of control. We will cross that bridge. My opinion, we will cross that bridge when it comes time to do so. We've survived so far, and we will survive that too.
Okay, well, that's a very optimistic take, so I'm happy about that, because it seems like you have very solid opinions on things, so it's reassuring for me. Rachel, thank you very much for being here. It's been great to get an inside look on the medical aspect and, all the risks involved. I think a lot of people don't really think about this much, and there's obviously a whole world of stuff going on there that, if you're in it, is kind of maybe even obvious, but when you're not in it, it can be something completely, like you see the tip of an iceberg and you don't know all that stuff that's going on. So thank you for kind of illustrating this to us. Also, big thanks to my co-host Kavya Perlman, to Marco Magnano, who's the editor of the show, and to the rest of the team. That's Ryan Wegner, or Wegner, I still haven't figured out which one it is, Tim Stifler-Dean, David Chever, and Ross Newman. To all of you viewing or listening, you can follow us on readyhacker1.com, find us on Facebook or YouTube under the name Singularity Watch, where you can watch this show and also all the previous ones. Or if you want audio only for when you're baking a cake or some cookies or something, you can listen to the podcast on Spotify, Spreaker, and Apple Podcasts. And that's all for now. Happy journeys to all of you, and have a good time.
Thank you.